She's actually, although she's homeless and appears lost, she actually is the one who has a deep drive to find her place. So we felt like she could be possessed of this inner calm and this inner strength because she knew that she would eventually make her way home. Over the time, of course, and being homeless and the things that it does to you and the experience that she had, that wavers, and you see that when she has these near misses with her cousin. It's like she's afraid to go back. Maybe it's too late, but actually we wanted to play Mata with a deep sense of something other than tragedy. And I think that's one of the things that Tania does so beautifully, because both as a person and an actor, she has a very deep grace and gracefulness to her.
For those who've seen the film already, perhaps even those who've been involved with it, what impact are you seeing it have on them?
We're halfway through a marae tour. So just in terms of that audience and going back to Ngāpuhi, to my marae and Ngāti Hau, and also to Tania's marae and Ngāwhā, there's been such resonance. So we've played the film and then there's been silence, and then gradually people have stood up and started to talk. And a lot of the stories have been stories of their own dislocation, or maybe their grandmother's dislocation, that feeling of the need to belong somewhere, to feel whole. So I guess for me, I didn't really expect that.
Bra Gray-Smith and Ainsley Gardner. We'll put the full interview up on our webpage for you. Cousins is in cinemas from the 4th of March. Of course, the new alert levels will have an impact on cinemas, especially in Auckland. And a reminder that we'll be crossing to the Beehive for a live media conference that's due to start at 1 o'clock. Hopefully will happen during the 1 o'clock news. Today, in honour of the film Cousins, though, here's an artist who goes by Elephant Micah with a song called My Cousin's King.
Cousin's king is waking to survey his domain again. Now that the rainfall is lifting, the shadows have blown from the sand. And this is the morning, it is the dawning, that we would pay for at the border of the day.
RNZ News at 1 o'clock. Good afternoon, I'm Sarah Bradley. The Prime Minister and the Director-General of Health, Dr Ashley Bloomfield, will provide a Covid-19 update in the Beehive Theaterette shortly. We'll cross there as soon as it starts, but in the meantime, here are the latest headlines. Genomic sequencing has confirmed the latest community case of COVID-19 in Auckland are linked to the South Auckland cluster. The cases have resulted in Auckland going to alert level 3 for 7 days and the rest of the country to level 2. The Office of the COVID-19 Response Minister has also confirmed the 2 cases in one family have the UK variant of the virus. A younger member of the family attends Papatoetoe High School, but they have tested negative. The Auckland Mayor, Phil Goff, wants tougher measures against people ignoring COVID-19 health guidance. Mr Goff says it's frustrating to learn one of the latest 2 community cases wasn't isolating while symptomatic. He says, for example, he'd like police to sanction people for not wearing masks on public transport. Mr Goff says people need to stop thinking they are immune or that the rules don't apply to them. The Auckland Business Chamber says the Level 3 restrictions will be a devastating blow to businesses. The Chamber's Chief Executive, Michael Barnett, says for many Auckland businesses it will be a week of uncertainty and they will be looking at how to handle their supply chains, landlords and banks. The United States President is urging the Senate to quickly approve his coronavirus aid bill. The $2 trillion bill was passed by a narrow majority in the House of Representatives. It seeks to stabilise the economy by giving cash payments to millions of Americans and boosting unemployment payments. Unemployment in America is now at almost 10%. The Dominican Republic will begin constructing a fence along its 376-kilometre border with Haiti later this year to curb unauthorised migration and illicit trade in drugs and stolen cars. The barrier will include a double fence in problem sections, along with motion sensors, facial recognition cameras and infrared systems. 500,000 Haitian immigrants live in the Dominican Republic. And the chair of the Taranaki Regional Council says it was disappointing to have to take prosecutions which triggered $600,000 in fines in the past week. The New Plymouth District Council, City Care, GrainCorp and Silver Fern Farms were each heavily fined in the Environment Court. In the worst case, Silver Ferns Farms was fined $337,000 for an ammonia spill that killed thousands of fish in the Tawhiti stream near Hawara. David McLeod says the legal offensive was aimed at changing behaviours. He says the public expected nothing less than prosecutions given the severity of the offending. That's the news. We will be heading to the Beehive as soon as the conference starts, the media conference with the Prime Minister and the Director General of Health. But in the meantime, here is the Met Service long-range forecast for all of New Zealand to midnight on Thursday. First of all, the situation. A warm, humid northeasterly flow covers Aotearoa, New Zealand. A weak front is moving slowly onto the west of the country during Monday. First of all, looking at the weather to midnight tomorrow. For Northland, Auckland, Coromandel Peninsula, Waikato, Bay of Plenty and Gisborne. Partly cloudy with isolated showers, possible thunderstorms in Northland and Auckland tomorrow afternoon and evening. For Hawke's Bay and Wairarapa, also Waitomo to Wellington, including the Central High Country. Cloudy periods, isolated showers.
Kia ora koutou katoa. Good afternoon, everyone. We are now 7 hours into Alert Level 3 restrictions in Auckland and Alert Level 2 in the rest of the country. I'm going to pass shortly to Dr. Bloomfield to provide an update on the latest health and testing information. Before I do, there are a couple of key messages I really want to emphasise, so I'm going to start with right at the top of my remarks. We have thankfully been without loss of life via Covid-19 for some time. But that is still the primary reason we take these strict, short and sharp measures. COVID kills people. Just recently, we saw the United States mark a devastating milestone in terms of the scale of lives lost in their country. We must never lose sight of the reason we take these measures. It is to save our people's lives and to save their livelihoods. The second reminder is that we know what to do. We have to just make sure we all do it well. So here are our asks. If you have visited any of the sites of interest that cases have been to, or have any cold and flu symptoms, including aches and fatigue, please get tested straight away. We need people to get tested as soon as they become sick so we can get on top of these latest events and stop any potential spread. Secondly, when you get a test, you must isolate at home until you receive a negative test result. You are not allowed to go to work or to any other place until you are given the all clear. There is financial support available to help anyone who may need to miss work for that reason. I'll share further details on that later on. Third, we need people to stay home to break the chain of transmission. If you can work from home, please do. You should only be leaving your house for essential reasons such as going to the supermarket. We've beaten COVID's chain of transmission before, and it's even more important that we do it again. That's because we are dealing with a more transmissible strain, but also because we are so close to getting an extra layer of protection into our border system through our vaccine rollout. We just need to keep going. I'll now pass to Dr. Bloomfield before coming back with a few extra details about our response. Dr. Bloomfield.
Thank you, Prime Minister. Kia ora koutou katoa. So today I can report there are no new positive cases of COVID-19 in the community. And on our 2 positive cases announced last evening, Case M has moved already to the Auckland quarantine facility, and his mother, who tested positive late yesterday, is on the way. The balance of the family, who again have already been tested and returned to negative tests, is currently isolating at home with support. Now, as you would have heard from the whole advice we have from ESR is that most closely links back to one of our families already identified in this cluster, the second of the families that includes cases D, E, F, G and H. Our contact tracers have already been able to identify a link between the 2 families, which is very helpful and also consistent with the results of the whole genome sequencing. Furthermore, all the genome sequencing in the cases to date does suggest or supports that they are all part of a single cluster. They are all linked, and that reinforces that we are still only looking for one source of infection. We haven't got multiple infections that have led to a range of different clusters. And the sequencing of the mother, case N, in the family is expected back later today. We do continue the overall source investigation. That's a focus, and that work has been led by Auckland Regional Public Health with support from ourselves at the Ministry of Health and ESR, and the whole genome sequencing will of course help with that, as will investigating any epidemiological links. Our wastewater testing in Auckland continues to not identify any wider cases in the community. There are plenty of testing stations open today across the Auckland region. The locations are on the Auckland Regional Public Health website. And by 10:30 this morning, we're already seeing a great response with 755 tests already completed by that time across Auckland. Thank you to those who are coming forward. And we do want to currently be isolating and remaining at home. Just on the MIT campus, last night as we released the information, we gave the address of the campus as the Otara campus as we moved at pace last night, and there was also some incorrect dates published. The correct dates of exposure, as I said, are February the 22nd, 24th and 25th, and the correct information is now on our website. Healthline has brought in additional staff today to help meet demand, and yesterday spoke to 2,790 people. A reminder, please leave Healthline for people who do need information about being tested as part of the current investigation, or who have other health issues they need advice on. If you just need general information, including places where you can get a test, then please look on the websites for that information. In terms of how the border arrangements are working around the Auckland region, the Ministry for Business, Innovation and Employment is working with the Ministry of Justice to ensure essential workers have got the permissions they need to get through the border, and that process to date has been working very well. Finally, just a couple of important reminders from me. This new variant of the virus, the B117, does seem to be...
We can build a very direct picture of how our latest COVID cases became infected. However, finding the source of this case was only one of the reasons we moved to Alert Level 3. The other reason was the number of exposure events for the latest case, with potentially large groups of people over a sustained period of time. That high number of events means it's more than likely there will be additional cases in the community, but they might not show up in test results for a few more days yet. That is why it is so important close and those casual contacts of all our COVID cases get tested in the coming days. Getting tested and staying home and isolated will help us to save lives and ensure we get the economy back up and running as soon as we can. We do undertake regular check-ins with those who needs to stay home because they've potentially come into contact with COVID-19. This is a one-off payment of $350. On this, I want to thank the many businesses who have been proactive in this space, helping to keep their workforce safe. But I also have a new request. Please check with your workforce to see if any are close or casual contacts of any of these cases or have visited any of the sites of interest, and ensure if they are amongst those who need to be isolating, make sure they don't come to work and that they get tested. Please also make sure that you access absence payments so you're able to continue to support your workers financially. Beating COVID is a team effort. And despite our best efforts to date, recent cases have gone to work when they shouldn't have. All of us need to do what we can to ensure those who are most at risk of having the virus staying at home. Doing so will help us get back to lower alert levels quicker and ultimately keep everyone safe. Also available is the Leave Support Scheme, which is for those who meet certain criteria and have to self-isolate, cannot go to work and cannot work from home. MSD, Whānau Ora and other agencies are standing up additional support to ensure testing and welfare support is implemented. We'll post this information on the COVID-19 website and update you regularly throughout, making sure that different groups that we're convening knew that they were in breach of the order in place that says no public gatherings.
If they didn't know about it, have you done your job properly?
Well, look, ultimately we do everything we can in terms of sharing the message as soon as we can. We use the civil defence alerts. Many of you will have received that blurring through on your phone once the alert level was in place. You do a job of helping us amplify that. We are always looking for more and better ways to communicate, particularly with harder to reach communities where there may be language barriers. But we try to leave as little excuse as possible for not hearing the message that we are in alert level 3 in Auckland. Tova.
These check-ins that health are doing to ensure that people are isolating, how often have those spot checks been happening to date, and are you going to ramp that up more results and there are any more positive cases in the community? Is there any way that we would move down alert levels sooner?
Well, I think one of the things that we're feeling quite cautious about is the fact that this particular variant does seem to be suggesting that it has a longer tail. And so it may be that we have a clear period and we may see positives slightly later down the track. So we'll want to take advice from officials and our experts on that. Dr. Bloomfield, do you want to add to that?
Yeah, just to add to that, I mean, we are seeing with this variant just some unpredictability, and this is what we saw in the school where we had when the decision was made to take Auckland out of alert level 2 to alert level 1, we had a lot of information. Out of the close contacts in the class of our initial our initial case A, we had one who had tested positive. We had none from over 95% of testing in the wider school. But then one appeared just right at the last minute there. So we've followed that through. We had nothing further from the workplaces or any other places at that time. So I think what we'll be doing is reflecting on the fact that KCM was out in the community and potentially infectious right up until yesterday. So we will want to be very certain that we have captured any potential possible infections before we start.
While we moved the rest of the country to different alert levels, there were a group of people who were always required throughout that period to be at home, and some haven't been.
Dr. Bloomfield, can you give us any more details about case M and the person-to-person contact? How do you think he actually might have contracted virus?
Well, what our contact tracers, the team in Auckland, have been able to establish is a link between the two families, actually not with case M, but with another member of the family and that middle family that had the 5 cases. I don't have any further details about that, but from in terms of where we are now, that's hugely helpful information because it confirms the genome linkage that there is a good explanation for how cases M and N got infected, and the sense that we're not dealing with them having been infected through some casual exposure in the community.
When you say link, you mean that they were in the same place at the same time at some point? Or?
Yes, exactly.
Yeah. And I cannot emphasise, if we're able to absolutely confirm that contact between these families, how helpful that is to us. Because of course the risk we always have is, even if we have a genome link that says they're really tightly connected, we don't always know whether or not there's been 1 or 2 people in between. In this case, the suggestion is there may not have been. It's a direct link, and that narrows down so many other potential chains of transmission. I'll just, if you don't mind, Toby, I'll canvass around a little bit and then come and so on. And what I would say, of course, is we're devastated for those who are caught up in that, for the fans, for the people who have bought tickets, of course. But I think we all know that we've been operating in an environment where we've been very, very lucky to have been able to hold large-scale events where no one else in the world has. But with COVID does come the risk that from time to time we may be in a period where events cannot take place. It would be for the Minister for Sport to really discuss whether or not there's anything else there between the organising bodies, but certainly for the private sector, they've been having to wear this risk.
You're open to them coming to you?
Oh, look, I'm just not in a position to be able to speak in any detail to anything in that regard. But I think all of us look with some gratitude at what we have been able to do, and we've always acknowledged that with large-scale events there are inherent risks when you're in the middle of a pandemic.
Just on COVID, probably a little bit for the rest of the country. I mean, if you establish that direct contact, that direct link, and negative cases start, negative tests start rolling through.
And remain observant of how many contacts there were in this case. It was too soon to say that we didn't have travel from outside of Auckland to other parts of the country. We didn't want to leave the rest of the country exposed, so we've taken that precautionary approach. But we will, as we look at all of the alert levels, keep looking at whether 2's necessary all the way through.
Instead of calling off the boxing event last night, given that you found out about the case in the afternoon, and also given the fact that both fighters are from South Auckland, are you concerned about the amount of people from Papatoetoe in particular who would have been there?
So a couple of things to really, it would be helpful to canvass there. So whilst I was advised at 3 o'clock in the afternoon, we had almost no detail at that point. We knew he had a positive case, and at that point the case self-identified as being linked to the high school. So at that point we were not clear on whether or not this was potentially the contact of a student or someone within the schooling community, something that could have given a very simple and straightforward explanation that may not have had a lot of exposure events and therefore could have justified staying at lower alert levels. The level of detail required to make the decision to move alert levels really started coming in a few hours later. We convened Cabinet as quickly as we could after we had information from Public Health. So that was coming through around 5:30 through till 6. Cabinet convened at 7:30. We discussed how we would manage large-scale events. Time we make the decision, and then we have to try and transition to that place. We generally do it very swiftly relative to even how quickly we've done it in the past.
That MP that you're talking about is Willie Jackson. So he was on the Cabinet call. In fact, we understand he stepped out of the crowd to take that call and then came back in. So he had learned that Auckland was going into level 3. Is it still appropriate that he went back into the boxing match rather than just leaving straight away?
Jason, so you'll appreciate that I did not have an individual conversation with every member of my team or Cabinet about what their individual movement should or would be for the remainder of an evening. I was very focused on making sure that New Zealanders had the information they needed. We also issued at that time a view around when the order would come in place, which was 6 a.m. Yeah.
Epidemiological link between
Yep.
family 2 and 4.
Yeah.
Is that, is the implication that the student who's tested negative 3 times. Is that
No.
part of the link?
No. No, that's not the suggestion. We're still gathering information. There's not a suggestion here that we've had a situation of failed testing. No.
From Nigeria, and one travelled from the USA via Australia.
There we go. So that explains the situation, which is why we've always been very cautious about those trans-Tasman flights where they're mixed. Jessica.
On the issue of South Auckland and prioritising them perhaps before rest homes at the time.
For vaccinations.
Yes,
Yeah.
vaccinations. Is there merit in that, and are you considering that?
Yeah, and look, these are very valid questions. One thing it's probably worth updating you on, the best way that we can protect the South Auckland community, of course, is to make sure that we don't have any incursions at our border, which is why we've prioritised the border workforce. Of those who have been vaccinated to date, I'm advised that 75% have come from within the county's Manukau District Health Board. So that tells you that essentially we are vaccinating a South Auckland population by virtue of the workforce that we're vaccinating. So they remain a priority, because if we manage to put that extra layer of protection at our border, the likelihood of cases like this by that criteria fits with an early start.
You were saying it would be going out across the board and there wouldn't be priority bans for South Auckland necessarily. That's what you told us in our main.
No, the suggestion was always that we move away from the Tier 1 and Tier 2. We haven't suggested we're doing that because, as you've heard me just say, Tier 1 by default is South Auckland. 75% of those vaccinated already are coming from counties Manukau. Our border workforce is predominantly a South Auckland workforce. So we are. The question you're asking me is, would we put priority on that region when we start the general rollout as well, or at least that's what I'm now sharing with you. Sorry?
A question from a colleague.
Oh, if you allow me, I might just, before I move to your colleagues, pan to the ones in the room who haven't had a question. Yeah.
Same question. A law professor has told us that you've got the power to issue an order under the COVID Response Act for individuals to stay home and isolate,
Yep.
and that people can be punished if they don't follow
Actually,
those
it's your
orders.
power,
How
I believe.
often are you issuing those?
We had a Section 70 order over the Papatoetoe High School communities, so that for this cluster has already been used.
Yes, so Section 70 order is actually a medical officer of health order under the
not
Health
mine.
Act. But yes, the PM and the Minister for COVID response can issue one under the COVID Act as well, including those who were at those events last night are now on alert level 3 and should be remaining at home and looking out for symptoms. If they become symptomatic while they're at home, they should seek a test.
Wellington City Council appears to have pushed ahead with its waterfront markets this morning. There were easily more than 100 people there. Was that advisable, and should such an event happen under Alert Level 2?
Well, I think local bodies and others make these decisions, and I can't comment on that specific one. But I know there are many who have decided to not go ahead with events, and some who may have decided on balance to go ahead with things. But
We can always-
they should have in place appropriate measures to ensure that there is that people can remain physically distant and keep safe.
I mean, the council will have experienced us being in alert level 2 through the weekend markets before. I would expect them to apply the same protocols and rules we have in the past. So look, maybe it's something for us to go and check that the council has protocols in place for the way they're managing things like that. I'll come here and then, forgive me, I don't know your name, so I'll just point it. So I'll start here.
Staff to effectively monitor people who are required to self-isolate, and how many people do we know need to self-isolate at the moment? The number seems to be expanding as more people pop up.
Yes, so prior to going into alert level,
Is it acceptable that the IRD phone lines and website are still down when businesses need to access them, and do you know when they might be restored?
Monday. So this was a planned piece of work. IRD have been going through a business transformation project for a long period of time. This was pre-scheduled and was notified as being pre-scheduled beginning from Friday, moving through till Monday. It does not change any receipt of any of the applications for the resurgence payment. Those have all been received and lodged, and of course applications can continue from Monday. So we don't anticipate it causing any disruption other than the fact people just won't be able to lodge their requests in this period. It doesn't affect the wage subsidy. It's only for those seeking that resurgence payment, which has had applications open and received since last week.
Any church leaders in South Auckland who might be spreading or are listening to conspiracy theories about COVID? One leader has told us in South Auckland that this is an issue.
Look, we know that this is an issue generally. And so I wouldn't say it's specific to any form of leader. They exist, and we saw this last August. It's real. It even exists amongst communities who are directly experiencing the effects from memory. We then start moving through the wider health workforce, which is actually very large as well. And then, of course, Cabinet will be discussing again some of the sequencing framework beyond that, but that actually takes us through quite some time.
And just finally, why was Pride Party asked to close down last night when other events were not asked to close down ahead of this exam?
I'm not specifically aware of that. Maybe Dr. Bloomfield's got
I understand
details.
there was a miscommunication. I got a text through actually while I was up here with the Prime Minister, and we went back and tried to clarify that, but it was slightly too late. So it was just a miscommunication, and that was then clarified.
I think there might have been some confusion between the Pride Parade and some of the events after. The parade, of course, had already taken place. The party was still underway. I think that might have been part of it.
In touch and telling anyone from...
It was one of my colleagues getting in touch with the Pride Party on the basis that the conversation we had, she had heard part of the information.
That's a really positive step if that's able to be all tied down.
National's put out a release today calling for the rollout of rapid antigen testing, the nasal swabs with results back in 15 minutes. Is that on your radar?
We've constantly looked at the role that antigen testing might play in our overall response. Two things I would say. Of all the different testing modalities, antigen testing seems to still be the least reliable. Just pointing out also that the sputum testing or the saliva testing is actually still a PCR test. It goes through exactly the same lab process as the nasal swab. And what I would say also is that the time it takes to do the nasal swab is not that long, but of course we need to be sure the process around it is accurate. We've got correct details, NHI number and so on. We can turn around those tests if we need to within the space of an hour or two, which is what we were able to do yesterday with the PCR tests on the wider family of our new case.
Yep. Okay, we'll take last couple of questions.
Outside of a level 3 environment, are you confident that the leave support payments is enough, given it's about $1,200 a flat payment, and median rents in Auckland are median rents in Auckland are...
People weren't following the guidance they were being given. And so I don't think you would have considered that a reasonable ask, and I'm not sure Auckland would have considered that a reasonable ask. We can succeed again. We need people to follow the rules, and we can operate with these short, sharp measures if people do what we ask of them. Okay, I think
Prime
I'm...
Minister, just one more
go ahead, Dr. Bloomfield.
piece of information I want to clarify. Just a reminder that under Alert Level 3, and this is on behalf of my colleague, the Secretary of Education, schools are open for the children of essential workers and those who can't safely be at home. And so schools will be open in Auckland tomorrow for those categories. They are not closed.
Yeah,
Thank you.
yeah, but we, of course, ask them to.
You feel that Case M's family is isolating at home with support. What do you mean by support?
Making sure they've got the financial and other support, and of course that there's checking in to make sure that they can safely isolate at home. The discussion is on about whether it might be best for them to also move to the
To be
quarantine
clear, though, those are
facility.
the non-positive cases. So we have some positive